Well, number one for me is education. That is by far, in my opinion, the way to prevent. Education of the people that are involved in places where accidents and injuries happen. If we can get enough people, not necessarily healthcare providers or dentists, but everyone that is on sites where injuries happen, that will be schools, that will be training camp, and that would be, paramedics, that will be ER or emergency departments in every hospital, then we can, by far, number one, prevent by increasing the awareness of trauma and the possibility, by recognizing that the trauma may happen and look for ways to prevent it. And if it does happen, then we can also, by education and training, prepare these people to deal with the trauma in the most effective way, because timing is extremely essential. Now, the second way to prevent it is by protecting the teeth using mouth guards in cases of contact sports. Of course, not every sport requires a mouth guard, but there are sports that are highly correlated to dental injuries, mostly actually basketball being by far the number one sport related to injuries, and of course the other contact sports like hockey, soccer, football, and lacrosse are also very highly correlated. Now, a mouth guard, basically there are different types of mouth guards. The most popular are the ones that are actually commercially available, and parents can just buy in any normally sporting good store and boil. It's called boil and bite because you just put it in boiling or hot water and then adapt to the patient's mouth, or the child's mouth in this case. The problem with that system is that it's extremely uncomfortable, it is not very protective, and it doesn't actually allow the child or the patient or the athlete in this case to also perform as its best in the sport. We have research showing that those actually mouth guards are not very well adapted. So number one, children, especially children, actually don't even use it because it's not comfortable. Two, in a study we did about athletic performance, those mouth guards actually decreased their performance because of breathing issues and other problems that are related to performance in sports. So the most recommended mouth guard actually are the custom-made mouth guards, as we can see in the image, which is a mouth guard that is personalized and customized to each mouth or each patient or each athlete. We take an impression, and then in the lab we create a mouth guard that is extremely fitted. It is very well tolerated because it's not falling out, and it does allow a perfect breathing and phonetics, especially for example for quarterbacks. I'm always required to do that because they need to talk while wearing the mouth guard. So we trim that extremely well so they don't even pretty much feel they have a mouth guard in their mouth. So we can see, for example, here this is a football player wearing a mouth guard, very minor discomfort, or no discomfort at all. And here we have a child with the same type of mouth guard, again a customized mouth guard, and these again are extremely well tolerated, so children like it. They use it, which is the most important thing, because one that is cheap but it's not being used, it doesn't really help. And the third is that again it's comfortable and allows a full potential for athletic performance. For example, just to show you a study that was actually conducted to demonstrate the importance and the effectiveness of the efficacy of mouth guards in sports. This is a study that compared the amount of injuries in football players before 1962. 1962 was the year in which the use of mouth guard was mandatory or became mandatory for football in NCAA and NFL. So before that time, football players were suffering of approximately 50% in dental injuries. So that means half of the team would have suffered a dental injury throughout their training or football career. After that, a regulation of using mandatory use of mouth guard was effective in 1962, we are seeing in football only 1.4% of football players being injured because they are wearing a mouthguard. That, for example, is not happening in basketball. I'll show you an example. Basketball, unfortunately, till today, it is not mandatory to wear. Some athletes are wearing because they are self-aware and they want to keep their dentition and their aesthetics. But in this study, for example, which is more recent, published in the 90s, actually in a women basketball team, some of the players used mouthguard and some of them did not use mouthguard. And those that actually did not use the mouthguard, again, were about 30% of them were exposed or suffered from an injury during their basketball training or basketball career, while those that wore a mouthguard were only 2.8% of them were actually injured during their career. So again, here it's even probably more important than football because again, football will have a regulation and it's mandatory. In basketball, it's not. And that's why, like I said before, basketball is by far the #1 sport in which we see most of the injuries happening, and most of them quite severe.